Hey, Power People, this is the Power Living with Purpose podcast with David C. Henderson, and this is the health tip of the week. Monkeypox and COVID-19 versus your immune system. Now, this week's tip is sponsored by American Health and Fitness Services, and tips are always published weekly in the Tuskegee News. Now, over the last 2 years, as we've been going through this COVID-19 pandemic, we've heard the consistent messaging from the CDC and leading medical professionals all over the world. Now, notice, I didn't say conspiracy theorists all over the world on TikTok and Facebook and podcasts, but the leading medical professionals. And the advice has been consistent. Social distance when possible, wash and sanitize your hands, wear a mask when you're surrounded by others indoors, and get vaccinated and boosted. Okay, all of that made perfect common sense. However, throughout the whole 2 years, I still have not heard a strong, consistent message on improving your health and immune system through a healthy diet and exercise. Now, we have, however, heard about the benefits of supplements like zinc, vitamin C, vitamin D. Okay, great. However, that can still not make up for living an unhealthy lifestyle with an unhealthy diet, lack of exercise, being largely overweight, or having a lifestyle full of smoking, drinking, stress, and lack of sleep. So basically, this lack of focus on overall personal fitness and wellness is incredibly frustrating to health and fitness professionals like me, because what we already knew was going to be reflected in the COVID deaths was blatantly evident. And that is, healthier people did better and unhealthier people did worse against COVID. Therefore, it was no surprise to see that over 90% of people who died from COVID had pre-existing health conditions and were generally unhealthy or overweight. Now, age was a factor, but it was still more about health, because there were healthy people in their 90s and even over 100 who caught and survived COVID, while smokers in their 20s and 30s died from it, showing that old age was not the primary factor for surviving COVID, but it was overall health and therefore the strength of your immune system. Also, it's estimated that because now most adults and children in the world, especially in the United States, are not considered healthy, that it's possible that up to a fourth of all COVID survivors may have some resulting health problems for the rest of their lives. Personally, when I caught COVID in 2020, before the vaccines were available, I had heavy fatigue, heavy brain fog for 3 months after recovering. Then I had light fatigue and light brain fog for about 6 months. And it was really a whole full year before I can say I felt all the way back to normal, where I could run and lift weights and work out again at the same level that I could before COVID without experiencing extra soreness and extra fatigue. However, one thing that people may not realize is that the amount of viral load in the method that you got infected made a difference too. So like, versus somebody sneezing on you right next to you, or you touching something and you touching yourself, that is, in my case, I believe I was pumping gas and I wiped my sweat off my face before I realized, oh my God, what have I done? And so it's like breathing a small amount of harmful gas versus a large amount. But what's more dangerous is that for people who are not physically active like me, it's not a clear way to measure the reaction to exercise like I can, because I knew how much I could lift and how far I could run. And then I saw the huge difference after COVID. So inactive people may still be ticking time bombs right now and not even know it, if they still haven't adopted healthier lifestyles since recovering from COVID. So the other alarming statistic we saw was that over 90% of all COVID deaths last year in 2021 were among unvaccinated people. Duh. And also conspiracy theorists just had a heyday. And although they had a heyday on vaccines, at the end of the day, only 0.1% of billions of people worldwide reported complications from them. So it's worldwide. I emphasized all over the world, because a lot of people don't even think beyond the United States, even though we are only 3% of the world's population. Only a tiny little 3%. So 97% of the people in the world could care less about the United States, because they're more focused on their own lives, because they don't live here and what's best for them. So nearly 8 billion people on Earth, we're only a tiny little 3%, little 300 million people, a little bit over 300 million people. So it should go without saying that after billions of the vaccines were given out, it was evidently clear that that was the enormous factor that made the difference between life and death, along with how healthy you actually were. As of course, we led the world in deaths per capita because we led the world in conspiracy theories per capita. So because millions of Americans basically chose to just stay stuck on stupid for 2 years and not do what they needed to do, we all paid the price. Now, as we speak right now, COVID numbers are back on the rise again, and over 45% of United States counties are showing what is considered to be high levels of positivity rates above 15%. And we are now back to over 100,000 cases a week again. So I'm about to get my second booster shot and get my antibodies back up because, like I said, COVID was one of the worst experiences of my entire life. I have zero interest whatsoever in going back through all that again, and I wouldn't wish it on my worst enemy. So, but now we're looking back at the monkeypox epidemic, and not looking at the monkeypox epidemic with, as of this week, there being nearly 25,000 cases worldwide and over 5,000 of those cases coming from the United States. While the chance of death is extremely low, I think it's only like less than 10 people died worldwide, it's still a disease that takes 2 to 4 weeks to recover from on average, results in a moderate to severe rash on the face and other parts of the body like chickenpox, but worse, and it can cause fever, swollen lymph nodes, and muscle pain. So it's no fun. It's going to set you back, 2 to 4 weeks of your life. So despite it not being very fatal, typically people who have healthier immune systems, once again, will probably fare better against it. In terms of how it's spread, it's mostly through physical contact, not through the sneezing, but the physical contact. But that's kind of worse because that means when you're shopping and you're touching stuff that other people touch, if they had it, then they spread it to you. If you're not sanitizing your hands every so many minutes or shopping with some gloves on. As a result, we really got to focus on our hands right now. Again, because just because it isn't very deadly doesn't mean that if it keeps going on like COVID, it can't develop a new variant that is more deadly, just like we saw with the Delta variant and the others. And so next week in part 2, I'll talk more in depth about the latest research and statistics on monkeypox. But the bottom line is that regardless of what viruses or illnesses that are out there for us to be exposed to, it's pretty safe to say you will always stand a far better chance if you have a healthier immune system that comes out as a result of a diet that is not full of junk food, fast food, sweets, soda, white bread, processed foods, and you're not a smoker or heavy drinker, and you're not overstressed because you actually do think positive and you do have faith and you have successfully developed a regular exercise routine that challenges your body to the point of sweat and soreness. Now, if you need help with any of those, we now have a virtual fitness coaching and virtual diet coaching service available through American Health and Fitness Services for only $25 a month. And you can visit our website at AmericanHealthFit.com. That's AmericanHealthFit.com, or text or call us at 334-226-0627. And as always, have a safe, healthy, and blessed week. Stay powerful, my friends.